Let's Talk Nursing is brought to you by bjninform.com, a learning platform for bite-sized, evidence-based content that supports all aspects of nursing. My name is Caroline Vogt, and I'm editor of BJN Inform. In each episode, I talk with experts about different topics affecting nursing practice, including person-centered care, nurse well-being, and career development. In this episode, I am joined by Tracy Cartwright and Daniel Hodgkins to discuss nursing students' transition into qualified practice. We explore the challenges they face, the support systems available, the impact of workplace culture, and issues around well-being and retention. We discuss practical tips and strategies for students, education providers, and employers. This podcast recording took place on the 30th of January 2026. Let's meet our guests.
My name's Tracy, and I've been a nurse for about 26 years now, a long time. Most of the time, I've been in critical care and intensive care, the majority of my career. I moved into education several years ago, actually, within intensive care. That was a big part of my role, when I was in intensive care, supporting nurses who were either newly qualified or if they were completely new to ICU as well. But I now work as a senior lecturer in adult nursing, mainly with pre-registration students. And a lot of my focus is on helping them feel as prepared as possible for the next step into registered practice.
Hello, I'm Daniel. I've been a registered nurse for nearly 17 years now. I've worked in quite a few settings. I started off in Nottingham, working in a general medicine and diabetes ward. Then moved to Oxford, where I've worked in a couple of different cardiac areas. So I worked in cardiac cath labs, and I worked in the coronary care unit for a couple of years. From there, moved into the cardiac intensive care, where I spent about 3 years. But then spent the vast majority of my career to date working in the neuro intensive care. The last 3 years of that I spent in an education role. So as Tracy was just saying, a lot of supporting new nurses, getting them established in that quite unique environment that is intensive care. And then my last year working for the NHS directly, I was working for the Trust education team. So I was helping to run the Preceptorship team for the Trust, so the Preceptorship programme for our newly qualified professionals in the Trust. So that included nurses, midwives, but also all our MDT, our physiotherapists, our occupational therapists, radiographers. And I was doing a lot of work with undergraduate students within the Trust. I joined Buckingham New University almost a year ago, and I've been working then mainly with undergraduate students.
Thank you very much. Okay, shall we dive right in then? First of all, why is the transition to practice such a critical period in a nurse's career? Tracy, would you like to start?
Yeah, sure. It's definitely a critical period. That's when everything changes, really, almost overnight. So you go from being like a supernumerary student to suddenly being responsible for patients, for decisions, for their outcomes even. So even really kind of capable, confident students can find that shift quite unsettling. It's not just about the skills, it's also about confidence and judgment, and learning to live with that uncertainty, I suppose. So I think it's a really crucial period because that can really shape how someone sees themselves as a nurse, those early days.
Daniel, would you like to add anything?
Yes, I certainly think it at the time it feels very significant. For the reasons that Tracy just said, it's the training wheels have just come off. I think the best analogy is like when you've just passed your driving test. It's one thing driving the car when you've got the instructor or one of your parents sat next to you, sort of stopping you from steering off the road or giving you a few words of advice. But then suddenly when you find yourself in the car by yourself and it's just you, it's a very different experience. I think it's also when you realise often that you haven't just finished your education journey. In a lot of ways, that journey has just started and you've got so much more to learn as a qualified nurse. So I think that can be quite overwhelming.
Yeah, definitely. It's almost like you realise what you don't know when you start out as a qualified nurse.
So that brings us straight to the main challenges that nursing students face when they moved into qualified practice. Are there any ones in particular that you'd like to highlight, Daniel?
So I think often the main challenge, or one of the main challenges, is that you're often moving into quite a specialist area. So your nurse training up to that date will be hopefully quite general. Hopefully you'll have worked in a number of different clinical areas. But then you'll suddenly find yourself working in a specialist area, and you'll have a lot of learning that you'll have to do for that specific area. So I think that can be quite a big challenge.
Tracy, would you like to add anything to this?
Yeah, sure. I mean, I think thinking back to as well when I started and in my experience, one of the biggest challenges is that kind of weight of responsibility you suddenly feel. Students often have learnt some of the knowledge in university and then suddenly they're the ones making those decisions about patient care and prioritizing care, and that can feel really daunting. And there's the emotional side as well, dealing with patients who perhaps deteriorate, dealing with complaints or things that don't quite go as planned. And a lot of newly qualified nurses, they probably carry this fear quite quietly, that they somehow feel that they're not good enough, but even when they absolutely are. So I think a lot of it's to do with confidence, really.
So how does workplace culture, for example, come into play to support those nurses into practice?
Yeah, I think a workplace culture can either make that journey a lot easier or a lot harder, definitely. I think we're all aware that the NHS is under strain a little bit at the moment. So, as a newly qualified nurse, if you're finding yourself going into a clinical area where the staff are already feeling the strain, it can be quite easy for a lot of that to be then passed on to you, which can make that journey a little bit more difficult. Certainly, if you are working somewhere that's got a culture of really supporting new staff, has got a really structured way of supporting new staff, have got staff, most importantly, that are enthusiastic, that want to support new staff, that makes a huge difference. If you're going somewhere where all the staff are kind of on survival mode, they can be very well meaning, but they're so busy sort of trying to keep their own heads above water that it can be that bit harder, I think, to give time to your newly qualified nurses.
I wholeheartedly agree with that, definitely. Where culture is less supportive, then the nurses can feel like they're constantly trying not to get things wrong rather than learning. So it makes a huge difference. It has a massive impact on newly qualified nurses. Definitely, culture really matters.
What about the fear of making mistakes? How does that affect newly qualified nurses? Tracy,
Mm.
would you like to start?
Yeah, sure. And that's a big discussion that's had during their training as well. Human errors and human factors is a big aspect of their training, and the fear of making mistakes is very real. And honestly, it's something that I still see, years into people's careers, they still have that fear. But for new nurses, that fear can be particularly paralyzing. They might second guess themselves constantly, or they might avoid speaking up. And the irony is that fear can actually increase risk because, people don't feel safe to ask for help, and that can cause more problems. So creating environments where learning from mistakes is kind of normal is essential, I feel.
Daniel?
Yeah, I think I'd say that actually, when I'm working with newly qualified nurses, I'm a little bit anxious if they're not a little bit worried about making mistakes. You want to see people come in and be aware that they're starting a new role, that there's new skills, and that the potential for getting it wrong. So I think new qualified nurses that are a bit anxious, I would say that's completely normal and not
Yeah.
unhealthy. But it's when it gets overwhelming, and as Tracy was saying, it can get paralyzing, and you just second guess yourself so much that you can't do anything. I definitely remember as a newly qualified nurse leaving my shift, waiting for the phone call for was whoever's coming on the night shift telling me exactly what I've done wrong, and it had disastrous consequences. That phone call never came, but definitely that fear was very real.
Yeah, that's a very good point, definitely. Yeah. And a little bit of anxiety is, as Dan said, completely normal. And, we almost want that and expect that in many ways.
You get
So,
people to go to the opposite extreme, don't you? You do meet the odd newly qualified member of staff that 2 minutes in, they already seem to think they're bulletproof. They already seem to think they're experts, and I always find that more concerning than someone who's a little bit cautious.
Yes, definitely.
so what can be done then to support people who are just entering practice?
Well, I think definitely that consistent, reliable support makes a big difference. Um, I think having a buddy system for newly qualified nurses so that they have somebody they can really trust who they work closely with. Preceptorship, that's really meaningful, is important, not just a tick box exercise, but really meaningful preceptorship. Protected time, having that protected time to talk with their buddy, with their mentors, time to reflect and ask questions. That's really, really invaluable, really. But I think also it's knowing that on a shift there's always somebody that you can turn to without feeling like you're being a burden. That's important, I think, for newly qualified nurses.
How can we support newly qualified nurses to be confident enough to ask for help?
Yeah, I think having a very supportive buddy system and having that support network there, a good mentoring system, good preceptorship system, it goes back to culture as well, having that supportive culture, open door, welcoming, very approachable. So it really is important that the mentors and buddies that the newly qualified nurses are working with are very open to questions and welcome questions.
I think can really help if that buddy or that mentor is actively going out and making sure that that newly qualified nurse is okay as well, because sometimes newly qualified staff are very reluctant to ask for the help. They don't want to appear too needy, or they're bothering you, and actually having someone come over and say like, are you okay, can you run things through, actually taking quite a proactive approach can be really helpful.
Which I guess is what you both mentioned earlier, with an NHS that's already under strain, can fall by the wayside. I mean, that time to actually proactively go and check on them might not be there. It might be more difficult to do.
So I think the newly qualified nurses need to just have that bit of confidence to ask questions. Don't be afraid to ask for help and ask for support. That's completely normal, and that's expected. We would worry if they weren't asking for help and support. So definitely they should feel confident enough to ask for help with go to a trusted person that's on their ward or on their unit or department.
Do you have any specific examples of a support strategy that works well in practice?
So I think actually having a structured supernumerary time, having a structure for someone's first year can be really helpful. It can be really helpful in giving that member of staff sort of realistic goals to aim for. Otherwise, I think you're kind of floundering a little bit. You've got this idea that you want to get better, that you want to be good at your role. But if you don't want, I suppose I should talk about SMART objectives. Everyone rolls their eyes when you talk about SMART objectives, but they are very important. So in my previous role, we had a very structured supernumerary period. We had certain proficiencies that newly qualified staff were meant to try and complete by certain points, and they should be helped to complete during the supernumerary period. And then once they've left that supernumerary period again, they would have certain proficiencies that we would be aiming for, and we'd have meetings scheduled in with them at regular basis. So you did have that structure. You weren't just kind of trying to make it up as you went along. There was real guidance about what you should be doing when. And I think that can really help to actually make you feel like you're getting there, that you're making that progress, you're developing in that profession.
That structured approach is really important at that initial time, that preceptorship time. But also, I think peer support as well. I think it's important to have a buddy or a mentor that is almost not too junior, but certainly hasn't qualified long before, so that they can really relate to that newly qualified nurse. Someone is at a similar stage who remembers feeling the same doubts and the same anxieties can really help support that newly qualified nurse.
In terms of education and preparation, how well do you think nursing programs prepare students for the realities of qualified practice?
I think we do a fairly good job, actually. I think there's definitely been improvement since I was a newly qualified nurse. So obviously all our nursing students spend a significant amount of time working in clinical practice. So, they're very much embedded during their training in the sort of areas where they'll be working when they're qualified, which I think makes a big help, which is a big help. I think the fact that people now do things like their intravenous medication training, their cannulation training, catheterization, all these skills as an undergraduate is really helpful. When I qualified, you learned all this stuff with a postgraduate skill, and it was just the extra layer of stress you didn't need. You were trying to get yourself used to this new way of working, or the pressure of the job. Then on top of that, you're also trying to get yourself signed off on intravenous medications or cannulation. So we also do a lot of practice-based learning, a lot of simulation now within universities. So we really, I think, do our best to try and prepare people for the realities of placement.
Yeah, absolutely. I agree, definitely. I think we give students a fairly solid theoretical base, and certainly simulation has played a big role in recent years, and that really does help prepare students for sort of the clinical skills, as Dan has said. At BNU, we provide a fantastic simulated learning experience for students. It's sort of simulating a placement experience almost. So we mock up a real ward environment, and we encourage students to work a shift within that ward with our high fidelity mannequins. We throw different scenarios at them regarding patients, that changing situations that you experience in a ward environment, and then they have to deal with those challenges. Again, we encourage them to make mistakes, encourage them to make decisions. We support them with that, and it's a sort of safe, really safe space for them to learn and to gain their confidence. So we found that simulation at BNU is rapidly evolving and improving all the time, and it creates great experiences for our students before they qualify. I think also we try and throughout simulation and also classroom sessions, we also try and help students sort of manage multiple priorities and prepare for that side of things. Thinking about time pressure and the emotional side of nursing as well. But even though they do have this training within their course, it can still come as a shock when they qualify. So it's making sure that they're prepared for that, really.
Are there any specific skills or experiences that could be strengthened before students qualify?
Yes, I think absolutely, always things could be strengthened. Decision making, prioritization, even things like managing deteriorating patients, they're quite big ones. And this is where simulation or simulated practice is really powerful. So if we could use that more, would really be beneficial for students. I think it gives students the chance then to step into the nurse's role and make those decisions and reflect afterwards in a safe place. Again, during simulation, we encourage them to make mistakes, talk them through, trying to learn without fear, and that hopefully can provide them with some confidence that carries over then into their practice.
I think that management placement that nursing students have, the final placement before they enter practice, is really important. I think that management placement should all be about slowly increasing that sense of autonomy. So yes, you should still be supported by your practice supervisor, by your practice assessor, but throughout that placement, I'd always be aiming for those supervisors, those assessors, to be slowly giving that student nurse that little bit more sense of autonomy, let them do more and more, so that when they actually then qualify, they feel that this isn't something that's new to them. They've been given that freedom to start developing a lot of those skills. I think that could be really important. And it does rely on having assessors and supervisors that are confident enough to actually give students a little bit of a free rein. It does take quite a lot of confidence to take that half a step back and maybe let people make a few small mistakes, or let people learn through doing.
Okay. And how can universities and practice partners better align expectations of new graduates?
It's quite tricky to do. I just sometimes feel like there's a little bit of a gulf. I know that Oxford Brookes, that me and Tracy both knew quite well in our previous roles, would invite newly qualified nurses, or nurses that have been qualified for about a year, to come and speak to their third year nursing students, to give them that sort of first-hand account. And I think that was really valuable. I think someone like myself, who's been qualified for a long time, can talk about it, but I'm never going to have that perspective. I can't remember it as vividly as someone who's gone through that experience recently. I think having that collaboration, especially in the third year between the higher education and universities, having people maybe from preceptorship programs from the hospital trust coming and actually talking to students can be really valuable in sort of bridging that gap in helping with that transition.
Absolutely. Communication and collaboration, that's crucial between practice partners and universities.
What role do nurse leaders and managers play in supporting newly registered nurses?
Well, I think leaders kind of set the tone, really. When leaders and managers, when they're visible, when they're approachable, genuinely invested in the development of newly qualified nurses or all of their nurses, it makes a really big difference. Also, I think leadership or managers and leaders, they play a big role in protecting that preceptorship time, ensuring that the new nurses have time with their preceptors and checking in regularly. That sends a real clear message that the new nurses matter and they're valued. So yeah, they do play a big part in it.
Then how do you think teams can proactively create environments where new nurses feel comfortable asking for help?
I think
Yeah.
having those mentors in place that are playing a really active role. I think it's trying to emphasize to the staff that actually looking after your new members of staff is a priority. And you have so many priorities when you're a nurse, and I fully sympathize with why people feel overwhelmed by it. But actually investing in your nurses, especially when they're really new, those first kind of few months, I think if you do invest some time, some energy into making those people feel comfortable, feel welcomed, that really does bear fruit, and you'll get much more engaged members of staff, much more comfortable members of staff, hopefully people that will stay in your organization, your clinical area for a long time, and ultimately everyone will benefit from that.
Yeah. I think language matters too. I think how we respond when someone asks for help, that sort of really sticks with them. So that, it really has an impact, definitely.
So that leads us then onto well-being and retention, which can be a bit of an issue at the moment. How does the transition period impact the well-being of new qualified nurses?
So I think for some people it has a very significant impact. I used to do a lot of work with the preceptorship program in my old trust, and I think everybody in the first couple of months is struggling a little bit. And I think that's one of the values of the preceptorship program is it helps newly qualified professionals talk to each other and at least appreciate that they're not in it alone, that everyone is in the same boat. And for some people, that anxiety continues for quite a long time afterwards. I think it can really have quite a negative effect on people in some occasions.
It can be exhausting, sort of emotionally and physically, when new nurses start. And many new nurses, they experience that anxiety, the poor sleep, that constant self-doubt. And if that's not recognised and supported early, it can escalate very quickly into burnout. So it's really important that we recognise that. And I think the NHS certainly is much better at that now, especially since COVID. That really has there's been a bit of a turning point, I think, in the support of nurses' well-being since COVID. So I think hopefully there are resources and support systems in place now that can recognise burnout quicker than previously.
Do you think this is one of the key moments that will then decide whether a nurse will be a nurse for a long time to come? Or
yeah, absolutely. The link is very clear, actually, and I've seen it in my experience, and also lots of research points to it as well, that nurses who feel supported and valued are far more likely to stay. Absolutely. And those who feel overwhelmed or unsupported or blamed, they start questioning their career choice very early on. So yeah, it's a crucial period.
All I say is it's a real shame that people have spent 3 years of their life, sometimes more, trying to work towards being a qualified nurse. And if people then within a year or so of qualifying decide they don't want to stay in that profession, that's a big shame for that individual. It's a big shame for us as a profession and the NHS in general.
is there anything else that could be done that
Yeah.
would be helpful?
I think definitely being truthful to the students during their training, and also focusing on resilience. Resilience isn't about telling nurses to be tougher. It's about creating systems that support them, but they also need to be realistic and and know what to expect with realistic workloads, protected learning time, access to support, making sure they know that there should be a culture of kindness, and that, when people feel cared for, they cope better. So I think it's getting that message across to organisations and working closely with the practice partners to make it clear that students and newly qualified nurses do need that support.
What about workloads?
I think that is one of the big often shocks that hits you as a newly qualified nurse. As a student, you can take your time a little bit if you want to spend a bit of time very slowly and carefully going through your assessments, recording your observations. Generally you've got that time, and then suddenly you qualify and you can suddenly see all these jobs coming at you, often at a faster rate than you feel like you can keep on top of them. I think if you combine that with the fear of making mistakes that we talked about earlier, so you're doubting yourself, but also the more you doubt yourself, the longer you take to make that decision, or the more you feel like you have to constantly ask, double check it, then the more those jobs kind of build up. So yeah, I think workload can be a problem.
Mm-hmm.
I think most clinical areas are mindful of that. Certainly anywhere that I've worked, we've tried to be mindful about which patients we give a newly qualified nurse. We wouldn't want to give them a lot of very, very busy patients, especially when they were new, or certainly that's your intention. As we all know, things change throughout the shift. You think you've given somebody quite a nice allocation, and by the end of the shift, you can find that the allocation didn't prove to be quite as kind as you initially thought. But yeah, I definitely think workload is a problem, and I think it's going to continue to be a problem going forward.
What advice would you give directly to nursing students who are about to qualify?
I think be patient with yourself, be kind to yourself. You're not expected to know everything. You're expected to ask questions. You're expected to be safe, which comes with asking questions, and always keep learning. As we mentioned earlier, as Dan, I think, mentioned earlier, learning is ongoing. So this is just the start, really. So just to keep learning, and confidence comes with time and experience. And it doesn't mean that they have to be perfect. There's no such thing as perfection. Just be patient and kind to yourself.
Yeah, it's a marathon, not a sprint. Don't constantly compare yourself with staff that have been qualified a lot longer than you. Of course, staff that have been qualified for 5 years, 10 years, 20 years plus are going to know more than you do when you're newly qualified. They're going to be a bit faster than you are, than when you're newly qualified. So don't feel like you have to be the best member of staff straight away. Be kind to yourself, as Tracy just said.
If you could give one key message to nurse educators or employers about supporting transition, what would it be?
I think be patient with your new members of staff. Sometimes I think new areas feel like they need people to progress at a certain rate, and they can be quite pushy. You can be quite pushy to get things like new skills, get proficiencies signed off, and people are kind of being quite strongly encouraged to sign up for further postgraduate qualifications quite quickly. And I think actually just being that little bit more patient with somebody, letting them find their feet, bears a lot of fruit. I think those first couple of months, helping people settle in are really crucial. And if we're creating a kind environment right from the start, that really does bear fruit further down the line.
Tracy, what would your key message be?
Yeah, I think that transition support is an investment, not a luxury. I think when we get it right, including tools like simulated practice learning, everyone benefits, the nurses, the whole team, and the patients. So yeah, I think take your time. Investment, not a luxury.
Okay, that's great. Is there anything else that you would like to add, Tracy, as we come to the end of the podcast?
I think that supporting newly qualified nurses to practice is a shared responsibility, really. When education and practice work together, we don't just prepare nurses to qualify, we prepare them to stay. We want them to stay for the benefit of everyone, especially obviously the patients who are the centre. So I think sharing that responsibility between education and practice, working together.
That's great. And you, Daniel, would you like
Um,
to say a few concluding words?
I think I'd say to any newly qualified nurses or people that are about to qualify that yes, it is a stressful transition, But most people get through that transition absolutely fine. And actually, most people within 18 months, a couple of years, really feel like they've found their feet. And that difficult transition feels like it was a long way behind them. So it doesn't take long, I don't think, for a lot of people to feel like you're past that point and that you're really starting to excel in your chosen profession.
Thank you for listening to the BJN Inform podcast. And a special thank you to Tracy and Daniel for sharing their time and expertise with us. If you enjoyed this episode, you can subscribe to the BJN Inform podcast on your preferred streaming platform so you never miss an episode. You can also listen to the podcast and explore our latest clinical and best practice articles online at bjninform.com. Until next time.